Let's begin with the first one, that is obviously schizophrenia, where you get auditory hallucinations. Like here, maybe this guy is having he is telling me subsequently that he can hear President Trump talking to him directly and telling him that I don't need the Nobel Prize and I really want that the Nobel Committee should give the Nobel Prize to you. You very well know President Trump was after the Nobel Committee for getting the Nobel Prize for stopping the so-called war between India and Pakistan, and he thinks that he has stopped so many wars. So here a person is saying that President Trump is directly talking to me. So if that would be happening, then I'm going to use the phrase, or I'm going to use the technical word, second person hallucination. But the second possibility is that he might say that President Trump and President Putin are discussing among themselves that this guy must be killed because this guy knows everything about the kind of discussions that we are having. So in those circumstances, when there's a running commentary or when people are discussing about him, one is President Trump is directly addressing him, that would be called as a second person hallucination. But when two people are discussing about him, then we will call it a third person hallucination. And in case the person says, let's call this person as X. So this X person is saying that whatever is his thoughts, that voice is repeating his person's own thoughts. So if you are gonna, if he says these phrases that I can hear my thoughts, Mr. X is saying that I can hear my thoughts being spoken out loud, a voice is like speaking out my mind, then we will be calling it a first person hallucination. At this particular point of time, guys, I want to make it clear that according to the DSM-5 criteria, all types of hallucinations are possible with respect to schizophrenia. It's not only auditory, but you would have even visceral hallucinations. Patients will say like, I feel as if my heart is burning. He will say that I feel as if my brain is being lacerated and is being torn by somebody. Some devil has gone into my head, and that alien or devil who has gone in my head, he's tearing apart my cerebral cortex. He's trying to tear apart my cerebellum. I mean, if he's medically oriented, he might use those terms. So what you get is one of the important diagnostic criteria, that is hallucinations. Along with that, obviously, you can be getting delusions as well. Like you can see a person who is thinking that he is like the king of the whole world, or you would have patients who would say that I am reincarnation of Lord Shiva. I mean, I had this same patient who was the antenna guy, right? He said, if I open my third eye, like if you read about our scriptures, right? Shivji, Lord Shiva, he has a third eye, right? When he will open the third eye, the whole world will get destroyed. So this guy, when I started turning skeptical about him, he told me, if I open my third eye, you'll get burned. And I was like, oh man, right? Have I really, upset this guy so much? So you would have hallucinations, you would have delusions of grandeur. And then more importantly, I think you all know about this, right? Ghar Ghar Modi. But at the moment, what we are talking about is the very classical delusion or doubles that could be present in this patient, which is called as Fregoli syndrome. And in Fregoli syndrome, like don't go by the word goli there. I mean, there's no goli. It's what is happening there is that in Fregoli, there is a false identification of strangers as friends. So I'll talk about Capgras subsequently, which would be diametrically opposite of this, but I'll just give you a heads up. A patient said that, his wife had come to meet this patient who's admitted. So he said that, no, this is not my wife. And this is a nurse who has put on a mask of my wife and has come to meet me. So if that's going to be the case where it's like a cloning that is happening, C for Capgras, C for cloning that is happening. Whereas in Fregoli, it is like false identification of strangers as friends. So if you just look at this image of like people putting a mask of Prime Minister Modi, I mean, Ghar Ghar Modi kinds, like it's Fregoli syndrome that is happening where like the strangers are being identified as friends by a person. So what I want to bring to your attention is one of the important diagnostic criteria for schizophrenia, hallucinations, then would be delusions, and they're total of 5. Now, before I go to my next slide, can you guys tell me, because you have gone through the main videos, can you tell me how many diagnostic criteria are must for diagnosis of schizophrenia according to the DSM-5 criteria? The total of 5 of them, right? I've talked about 2 at the moment, so how many should be present? Yes, guys, I give you like another maybe 5 seconds to think about it. Yes, you're right. It would be 2 out of 5 criteria. So I will be discussing and writing down those criteria so that you can remember them on a long-term basis. But this was just an introduction which I wanted to share. And now you guys again tell me what happens to dopamine levels in brain of a patient with schizophrenia. Just like you guys are comfortable with the fact that in Parkinson disease, dopamine level will be less. In patients who are having schizophrenia, dopamine levels can be more or they can be lesser. Yes, guys, both things can be happening. You could be having dopamine levels being higher, they can be lesser. Obviously, in a question where single best answer has to be given, you will say dopamine is more. But technically speaking, dopamine levels are gonna be increased where the dopamine levels will be increased in the mesolimbic pathway, and that will explain positive symptoms in a patient like delusion and hallucinations. But at the same time, in some questions, you will notice he has asked that dopamine levels are low in patients who are having schizophrenia. Yes, that is a correct statement. That would be lesser where then it would be answered by you as less in the mesocortical pathway. So don't blindly answer that dopamine levels are more, because lots of these questions would be having both increase and decrease in the options, and both of them are correct, because if it is decreased dopamine in the mesocortical pathway, it would explain negative symptoms. Negative symptoms is like alogia. What is alogia, guys? Alogia means like paucity of speech. So you could be having two possibilities. One is a schizophrenia patient could be a chatterbox and he's just talking some nonsensical stuff before you. And second, there could be possibility that the patient might be totally mum as well. So I'll discuss the subsequent negative symptoms as we go across. There are 5 that I'll discuss again. I mean, earlier I was saying 5 diagnostic criteria. I'll describe 5 negative symptoms before you, but alogia is one of them. And then is effect on glutamate. Now, as far as glutamate is concerned, you need to remember that the NMDA receptor hypofunction would be present in this case. And well, this is important for you to know that this again explains the negative symptoms. So 2 aspects for negative symptoms I can say at the moment: decreased levels of dopamine in the mesocortical area, and then NMDA receptor hypofunction with respect to glutamate in the prefrontal cortex again explains the negative symptoms. Then he will ask you about serotonin. Guys, this is again an important part, because the drug of choice for schizophrenia would be the category that we use is the second generation atypical antipsychotics, and they would be affecting the levels of serotonin. So what happens in schizophrenia is, why you get psychosis in these patients is because, again, when it comes to the receptors of serotonin, that is 5-HT2A receptors, these receptors will be exhibiting is a hyperactivity. So remember, for glutamate I was saying NMDA receptor hypofunction, here it is a hyperactivity that would be present, which contributes to psychosis. And to counterbalance this, because a 5-HT2A receptor hyperactivity is present, so to counterbalance this hyperactivity, we will be using atypical antipsychotics like risperidone or olanzapine for management of this patient. I'll write down the name of the drug subsequently, but then these drugs will block these 5-HT2A receptors, which are working more than normal and are contributing to psychotic manifestations in a patient. Last but not the least, even acetylcholine plays a role. Normally we study acetylcholine deficiency for Alzheimer's disease, but here it is acetylcholine receptors which are defect with respect to alpha 7 nicotinic receptors in the hippocampus and cortex, and that is why you will notice that a lot of these schizophrenia patients, they might be smoking as well. That's called as a self-medication hypothesis, but the learning point for you guys is that don't blindly answer dopamine is more. It can be more, it can be less in specific areas that I mentioned, especially the statement dopamine deficiency in mesocortical pathways to be remembered. Then is the hypofunction of the NMDA receptors, the hyperfunction of the 5-HT2, that is serotonin receptors, and acetylcholine receptors deficit is again to be remembered. So these are like the neurotransmitter effects, because they tend to go in detail regarding the pathogenesis of the disease. Now we will focus on the diagnostic criteria. And to explain this diagnostic criteria, well, I can say that if you look at Hrithik Roshan's character in the movie Koi Mil Gaya, there he was having this, a character played along with him, which was called as Jadoo, and he was supposed to be an alien. So one of the diagnostic features which would be present is obviously the hallucinations part, as I was explaining to you. And because the HRK's character, Hrithik Roshan's character at that particular point of time can hear jadoo. So therefore I can say that is one of the diagnostic criteria getting satisfied for schizophrenia. Then his second is a false fixed belief. I mean, whatever you tell this guy, he's not gonna believe you. He will say, no, no, I believe in the concept of aliens. So delusions is like belief of, for example, belief of aliens on Earth. It could be delusions of various that I'll be explaining to you. They could be delusion of reference, delusions. I mean, the person could be having delusion of persecution where he will say CIA is after me. In fact, here I want to talk about a Bollywood actress. Her name was Praveen Bobby. She has acted with Amitabh Bachchan, Shashi Kapoor, the legends of like 1980s, 80s and 90s when I was growing up. And Praveen Bobby being a famous actress, her career took a nosedive because she was diagnosed with schizophrenia. And if you read about her details online, you will come to know that she used to believe that CIA has poisoned her food. Believe me, yes, that's the documented fact. She used to say that CIA has poisoned my food and they're out to kill me. So like she stopped eating food and she used to eat only eggs because she thought that okay, eggs cannot be poisoned. So I mean, sad to see people suffering, and mental health aspects are very neglected in a country. So belief of aliens on Earth is again something which is not very normal. Delusion of persecution is not normal. So this would be again important diagnostic criteria which is to be remembered. Then can be disorganized speech. Disorganized speech would be like derailment. By derailment I mean, like I'll give an example to you for derailment. I asked the patient, why did you come to the hospital? So he began with like, I had high grade fever, and then he said taxi driver cancelled the ride and the car was blue in color and I love red color, and the nurse is like being very rude to me, and my dog died. And I was like, what? I simply asked him, why did you come to the hospital? So he should have told me, I'm having fever, I'm not feeling well. I mean, normal people would come to hospital when they have a problem. Here he told me he came to the hospital because of fever, but then he started going in different directions. So that is derailment. That is also called as Knight's move. So I'll be explaining more about this derailment part subsequently. I will compare derailments with like flight of ideas, with perseveration, with verbigeration, like a lot of technical terms would be there. But at the moment, what I just want to bring to your attention is derailment is like a trail derailment. No, like patient is going from point number A to point number B. Like he has come to the hospital. He will tell you I come to the hospital for a particular reason, but then he will start diverting in all different directions. Like he's telling you a lot of things. Like, my dog died, car is blue, weather is rainy, and the nurse is being judgmental. Now, can I get your phone number? I mean, a lot of weird things that he's talking about are coming after telling you why he came to the hospital. So he did reach the hospital, then got derailed. So that is like a Knight's move or a derailment. That is disorganized speech. Then is disorganized behavior like catatonia. Catatonia would be like a psychomotor manifestation. Like this particular person, if I keep his hand like this, if I keep his hand, let me describe like this. If I raise his hand like this and maybe put his other hand like this, he'll keep his arm. It's difficult to keep your hands in a particular position as long as you want. But in schizophrenia, lots of time you read about catatonia, you read about waxy flexibility in a patient. So that would be again a disorganized behavior that I'm describing. Along with this, sometimes the patient might be again saluting you. So there might be peculiar mannerisms that might be noticed, and that is the meaning of the word catatonia. This catatonia should not be confused with. This catatonia word should not be confused with another terminology that is called as cataplexy. Now, when do you read about cataplexy is when you're reading about the literature of narcolepsy. But cataplexy basically means that there would be a decrease in like the muscle tone of an individual. I repeat my fact that in cataplexy, what is happening is that there is not a waxy flexibility, but rather there is a decrease in the muscle tone of an individual. And this decrease in the muscle tone of the individual is occurring whenever there is gonna be like this guy is laughing on laughter, or for that matter of fact, if he's crying, and that is the time that he's losing his body posture, he'd fall down. And this is what you encounter in patients with narcolepsy. So there are two different terminologies that I have said. One is the word catalepsy, that is what you read in schizophrenia with catatonia, but the term that I used superiorly was cataplexy, which is related to totally a different domain, that is narcolepsy, which will be discussed subsequently in detail. And then you would be having another fifth manifestation coming up, that is like zero emotions, negative symptoms. One of the negative symptoms that we can encounter in these patients can be like alogia. Alogia would mean is like paucity of speech, or they could be anhedonia, they could be evolution. Anhedonia means lack of pleasure. So what you need to remember, like lots of you might be actually reading psychiatry first time and might be listening to me directly. So I just want to say that if you can just get these alphabets right, HTSB negative. HTSP negative would mean hallucinations, delusions, disorganized speech, disorganized behavior, and negative symptoms in a patient. That would be zero emotions. Like zero emotions is one of the ways to describe it. I'll repeat that once again. It is HD, that is hallucinations and delusions. Like I gave example of Koi Mil Gaya, Hrithik Roshan's character. He's believing in Jadoo. He's hearing Jadoo. He believes that Jadoo is real. There is disorganized speech also described in that character. There's disorganized behavior that can be present, and then there could be negative symptoms present. So HTSB negative is like what would help you remember the manifestations if you're reading for this for the first time. And out of these criteria, how many should be present for diagnosis? Then out of the 5 criteria, at least 2 or more should be present, with at least 1 should be present from the top 3. So mark my words there, guys, that when I talk about the diagnosis of schizophrenia from the top 3, that is hallucinations, delusions, and then disorganized speech, at least 1 out of the top 3 should be present, and there should be total of 2 manifestations present, and the symptoms should be lasting for then active phase of illness should be more than one month, and the total duration of symptoms for more than 6 months to say that the person is suffering from schizophrenia. So these diagnostic criteria are the ones which you have to remember at the moment according to DSM-5.